Today lesson English conversation at the doctor's clinic. David and Jessica learn English through dialogue.
Good morning. I have an appointment at 10 o'clock with Dr. Jessica Miller.
Good morning, sir. May I have your name, please?
Yes, my name is David Anderson.
Let me check. Ah, yes, here you are, Mr. Anderson. You're right on time. Have you visited our clinic before?
No, this is actually my first time here. My regular doctor is on vacation, so my friend recommended this clinic to me.
I see. In that case, could you please fill out this new patient form? It just asks for some basic information, your address, date of birth, insurance details, and a brief medical history.
Sure, no problem. Do you have a pen I could borrow?
Of course, here you go. Please take a seat in the waiting area, and Dr. Miller will call you in shortly.
Thank you very much. David sits down in the waiting room and begins filling out the form. A few minutes later, a nurse walks in. Mr. Anderson? Yes, that's me. Hi, I'm Jessica's nurse, Karen. Before you see the doctor, I need to take some basic measurements. Your height, weight, blood pressure, and temperature. Is that all right with you? Yes, that's fine. Great. Please step onto the scale first. David steps onto the scale. Okay, that's 175 pounds. Now, please stand straight here so I can measure your height. All right, 5'10". Now let's check your blood pressure. Please roll up your sleeve. Sure. The nurse wraps the blood pressure cuff around his arm. Just relax your arm and try not to talk for a moment. Okay. Your blood pressure is 122/80, which is completely normal. Now let me check your temperature. Please open your mouth. The nurse places a thermometer under his tongue. 98.6 degrees. That's normal as well. Dr. Miller will be with you in just a few minutes. Please follow me to examination room number 3. Thank you.
Good morning, Mr. Anderson. I'm Dr. Jessica Miller. It's nice to meet you.
Good morning, Dr. Miller. Nice to meet you too. Please, call me David.
All right, David. So what brings you in today? How can I help you?
Well, for the past 4 or 5 days, I've been feeling really unwell. I have a sore throat, a persistent cough, and I've been running a slight fever in the evenings.
I see. Let's talk about your symptoms in a bit more detail, so I can understand exactly what's going on. When did you first notice these symptoms?
It started last Wednesday. I woke up with a scratchy throat, and I thought it was just from the dry air in my office, but it got progressively worse over the next couple of days.
And the cough, is it a dry cough, or are you coughing up any mucus?
It's mostly a dry cough, but sometimes in the morning I do cough up a little bit of yellowish mucus.
Okay, that's helpful to know. And you mentioned a fever. Have you taken your temperature at home?
Yes, last night it was around 100.4 degrees. This morning it seemed a bit lower, maybe 99.5.
All right. Are you experiencing any other symptoms? Headache, body aches, chills, fatigue, runny nose, anything like that?
Actually, yes. I've had a pretty bad headache for the last 2 days, and I feel exhausted all the time, even though I've been getting enough sleep. My whole body kind of aches, especially my back and shoulders.
Have you had any chills or sweating episodes?
A couple of times, yes. Last night, I woke up shivering, and then about an hour later I was sweating.
That's a fairly classic sign of a fever spiking and then breaking. Do you have any nasal congestion or a runny nose?
A little bit of congestion, but it's not too bad. It's really the throat, the cough, and the fatigue that are bothering me the most.
Understood. Have you noticed any shortness of breath, chest pain, or difficulty breathing?
No, nothing like that. My breathing feels normal, just the cough is annoying, especially at night when I'm trying to sleep.
Good, that's reassuring. Any nausea, vomiting, or stomach issues?
No, my stomach has been fine.
Have you been around anyone recently who was sick? Family members, co-workers, anyone with similar symptoms?
Actually, now that you mention it, a coworker of mine was out sick last week with what she described as a bad cold. We sit fairly close to each other in the office.
That's useful information. It's quite possible you picked up a viral infection from her. Let me ask a few more questions before I examine you. Do you have any known allergies to medications or otherwise?
I'm allergic to penicillin. I broke out in hives when I took it as a teenager.
Thank you for letting me know, that's very important. I'll make a note of that in your chart. Are you currently taking any medications, prescription or over-the-counter?
I've been taking some over-the-counter cold medicine, and I took a couple of ibuprofen tablets yesterday for the headache and body aches.
Okay. Do you have any chronic medical conditions, diabetes, asthma, high blood pressure, anything like that?
No, I'm generally pretty healthy. I don't have any chronic conditions.
Have you had any surgeries in the past?
Just my wisdom teeth removed a few years ago, but nothing else.
And do you smoke or drink alcohol regularly?
I don't smoke. I drink socially, maybe a glass of wine once or twice a week.
That's good to know. All right, David, I think I have a fairly clear picture now. Let's move on to a physical examination so I can take a closer look and confirm what might be going on.
Sounds good to me.
First, I'm going to listen to your heart and lungs. Could you please sit up straight and take a few deep breaths for me?
Sure. Jessica places the stethoscope on David's back.
Take a deep breath in and out. Good, one more time, in and out. Now I'm going to listen to the front. She moves the stethoscope to his chest. Breathe normally for me now. Okay, your lungs sound clear, which is a good sign. No wheezing or crackling that would suggest something like pneumonia or bronchitis. Your heart rate and rhythm sound normal as well.
That's a relief to hear.
Now let's take a look at your throat. Could you open your mouth wide and say, "ah" for me?
Oh. Jessica uses a tongue depressor and a small light to examine his throat.
I can see your throat is quite red and inflamed, and your tonsils look a bit swollen. There's no visible white patches or pus, which is somewhat reassuring, since that can sometimes indicate a bacterial infection like strep throat. Does it hurt more when you swallow?
Yes, definitely. Swallowing food is uncomfortable, and even water sometimes stings a little.
That makes sense given what I'm seeing. Now let me check your lymph nodes. I'm going to gently feel along your neck and under your jaw. Jessica gently palpates David's neck. Does this hurt at all?
A little bit, right there on the left side.
I can feel that your lymph nodes are somewhat swollen and tender, which is common when your body is fighting off an infection. Now let's check your ears quickly. She uses an otoscope to look into his ears. Your ears look clear, no signs of infection there. Let me also check your sinuses by pressing gently around your face. Let me know if anything feels particularly tender or painful. She presses gently around his forehead, cheeks, and nose.
That spot under my eyes feels a little tender, but not too bad.
Okay, some mild sinus tenderness, which is consistent with the congestion you mentioned. Let's check your temperature again, just to see where things stand right now. The nurse hands her a thermometer. Please hold this under your tongue for a moment. A beep sounds. 99.8. Still a mild low-grade fever. All right, David, based on your symptoms and what I'm seeing during the examination, the sore throat, swollen tonsils without visible pus, the cough, mild congestion, fatigue, body aches, and low-grade fever, this is looking like a fairly typical viral upper respiratory infection, essentially what people commonly call a bad cold or possibly a mild case of the flu.
That's what I was suspecting too, but I wanted to be sure it wasn't something more serious, like strep throat.
That's a very reasonable concern, and it's smart that you came in. Given that there's no visible pus on your tonsils and your symptoms developed gradually rather than suddenly, strep throat seems less likely, but I'd still like to do a quick rapid strep test just to rule it out completely, since the treatment would be different if it turns out to be bacterial.
Okay, that makes sense. What does the test involve?
It's very simple. I'll use a small swab to collect a sample from the back of your throat and your tonsils. It might make you gag for a second, but it's over very quickly, and we'll have the results in about 10 minutes.
Sure, let's do it.
Okay, David, please tilt your head back slightly and open your mouth as wide as you can. Try to relax and it'll be over before you know it.
Okay, ready. Jessica swabs the back of his throat quickly, coughing slightly. Phew, That was a bit uncomfortable.
I know, I'm sorry about that, but you did great. That's the worst part over with. I'm going to send this to the lab technician right now, and we'll have your results shortly. In the meantime, would you like some water?
Yes, please, that would be great.
Karen, could you bring Mr. Anderson a glass of water, please?
Of course, right away. A few minutes later, the nurse returns with water, and shortly after, brings in the test results. Dr. Miller, here are the results of the rapid strep test.
Thank you, Karen. Jessica reviews the results. Good news, David, the rapid strep test came back negative. That confirms what I suspected. This is a viral infection rather than a bacterial one.
That's a relief. So, no antibiotics needed, right?
That's correct. Since this is viral, antibiotics wouldn't actually help, they only work against bacterial infections. Taking them unnecessarily can actually do more harm than good, including contributing to antibiotic resistance and disrupting your gut bacteria.
That makes sense. I've heard about antibiotic resistance being a growing problem.
Exactly, it's a serious public health concern, so we try to be very careful about only prescribing antibiotics when they're truly necessary. So let's talk about how we're going to manage your symptoms and help you feel better. Since this is a viral infection, the main approach is going to be supportive care, treating the symptoms while your body's immune system fights off the virus. Most viral infections like this resolve within 7 to 10 days.
Okay, that's good to know. What should I be doing?
First and foremost, rest is extremely important. Your body needs energy to fight off the infection, so I'd recommend taking it easy for the next few days. If possible, try to avoid going to work until your fever has been gone for at least 24 hours without medication.
I was actually planning on going back to work tomorrow, but I suppose I should hold off.
I'd really recommend it, both for your own recovery and to avoid spreading it to your coworkers, especially since you mentioned one of them was already sick recently. Give your body a couple more days to recover.
That makes sense. I'll talk to my manager today.
Second, staying hydrated is crucial. Try to drink plenty of fluids, water, herbal tea, clear broths. This helps thin out mucus, soothes your throat, and prevents dehydration, especially if you've been sweating from the fever.
I'll make sure to drink more water. I probably haven't been drinking enough these past few days.
That's very common when people don't feel well. For your sore throat specifically, I'd recommend gargling with warm salt water a few times a day. Just mix about half a teaspoon of salt into a cup of warm water and gargle for about 30 seconds before spitting it out. It really helps reduce inflammation and discomfort.
I've heard of that before, but never actually tried it.
It sounds simple, but it genuinely works quite well. You could also try warm tea with honey, which can soothe the throat too. Honey has natural antibacterial and anti-inflammatory properties. Just avoid giving honey to infants, though that doesn't apply to you, of course.
Laughing? No, I think I'm past that stage.
For the fever, headache, and body aches, you can continue taking over-the-counter pain relievers. Since you're allergic to penicillin, that shouldn't affect your ability to take something like acetaminophen or ibuprofen. Those are unrelated medication classes. However, I'd recommend switching between the two if needed, but never exceed the recommended dosage on the packaging.
I've been taking ibuprofen. Is it okay to keep doing that?
Yes, that should be fine, as long as you're taking it with food to protect your stomach, and not exceeding more than what's recommended, typically no more than 3 doses per day for over-the-counter strength, spaced about 6 to 8 hours apart. If your fever goes above 102 degrees, or if it persists for more than 3 or 4 more days, I'd want you to come back in or call us.
Understood.
For the cough, especially since it's bothering you at night, I'd suggest an over-the-counter cough suppressant if it's a dry, non-productive cough that's disrupting your sleep. However, if you're coughing up mucus, sometimes it's better not to suppress it too much, since coughing helps clear your airways. Using a humidifier in your bedroom at night can also help a lot, especially if the air in your home is dry.
I don't currently have a humidifier, but I could probably buy one.
That would be a good investment, not just for now but for future colds too. In the meantime, taking a hot shower and breathing in the steam before bed can have a similar soothing effect on your throat and airways.
That's a good tip. Thank you.
For the congestion, saline nasal spray or rinses can help clear out your sinuses without any medication side effects. You could also try an over-the-counter decongestant, but I wouldn't use those for more than 3 consecutive days, since they can actually cause rebound congestion if used longer than that.
Got it. I'll keep that in mind.
Lastly, nutrition matters too, even though I know your appetite might not be great right now. Try to eat light, nourishing foods, soups, broths, fruits rich in vitamin C, things that are easy on your throat and stomach but still give your body the nutrients it needs to recover.
I haven't had much of an appetite the last couple of days, to be honest.
That's completely normal when you're feeling unwell, but try not to go too long without eating anything at all. Even small, frequent meals are better than nothing.
I'll do my best.
Now, I want to go over some warning signs that would mean you should seek medical attention sooner rather than waiting it out, just so you know what to watch for.
Okay, please go ahead.
If you develop difficulty breathing or shortness of breath, chest pain, confusion, a very high fever above 103 degrees that doesn't respond to medication, or if your symptoms suddenly get significantly worse instead of gradually improving, you should seek care right away, either back here or at an urgent care center or emergency room, depending on severity.
That's good to know. I'll definitely keep an eye out for any of that.
Also, if your sore throat symptoms don't start improving within 5 to 7 days, or if you develop a new high fever after initially feeling better, that could indicate a secondary bacterial infection has developed, and at that point, we would want to reassess and possibly consider antibiotics.
Understood. Should I schedule a follow-up appointment, or only come back if something changes?
For now, I'd say only come back if you notice any of those warning signs, or if you're simply not improving at all after about a week. Most people in your situation start feeling noticeably better within 3 to 5 days, with full recovery within a week to 10 days.
That's reassuring. I was a little worried this might drag on longer.
It's a very common concern, but based on your presentation today, I don't have any reason to think this will be prolonged or complicated. Your lungs are clear, your test for strep was negative, and your symptoms, while uncomfortable, are fairly typical of a standard viral infection.
That's good to hear. Thank you for being so thorough.
Of course, that's what I'm here for. Do you have any other questions or concerns before we wrap up?
Actually, yes. I have a work trip planned for next week. Do you think I'll be well enough to travel by then?
That's a great question. Given the typical timeline for recovery, you should be feeling significantly better by then, especially if you rest properly over the next few days rather than pushing through and going to work while still sick. That said, if you're flying, keep in mind that congestion can make ear and sinus pressure changes during takeoff and landing a bit more uncomfortable, so I'd recommend using a decongestant a couple of hours before your flight if you're still congested at that point.
That's really helpful. Thank you. I hadn't thought about the flying aspect.
It's a common issue people don't consider until they're already on the plane. Also, make sure to stay hydrated during the flight, since airplane cabins have very dry air, which can aggravate a sore throat and cough.
I'll bring a water bottle and keep refilling it.
That's a great idea. Anything else on your mind?
That's reassuring. I sometimes feel guilty about resting so much.
There's no need to feel guilty at all. Rest is productive when your body is fighting an infection. Think of it as part of the treatment plan, not laziness.
That's a good way to put it. Thank you.
All right, I'm going to write you a note for work, if you'd like one, explaining that you should be excused for the next 2 to 3 days due to a viral infection.
Yes, that would be really helpful. Thank you. My office is usually pretty strict about needing documentation for sick days longer than 1 day.
No problem at all, that's very common. I'll also give you a small prescription for a stronger cough suppressant in case the over-the-counter version isn't cutting it, particularly for nighttime use so you can get better sleep. You don't have to fill it unless you feel you need it.
That's great. Thank you. I appreciate having the option.
Let me write that up for you now. Jessica types on her computer and prints out a few documents. Here you go, this is your work excuse note, and this is the prescription for the cough medicine. I've also printed out an after-visit summary that includes everything we discussed today, your diagnosis, the home care instructions, warning signs to watch for, and when to follow up if needed.
Thank you so much. This is really thorough. I appreciate you taking the time to explain everything so clearly.
Of course, that's exactly what I want for all my patients. It's important to me that you leave here understanding what's going on and feeling confident about how to take care of yourself.
I definitely do. This has been a really pleasant experience, especially since it was my first time at this clinic.
I'm glad to hear that. We'd be happy to have you as a regular patient here if you'd like, even after your usual doctor is back from vacation.
I might actually consider that. You've been very thorough and easy to talk to.
That means a lot, thank you. Before you head out, do you have any final questions about the medications, the home care instructions, or anything else we covered today?
I don't think so. I think you've covered everything really well. Oh, actually, one more thing. Is it okay to exercise at all, even lightly, or should I avoid it completely?
Good question. I'd recommend avoiding any strenuous exercise until your fever has completely resolved and you're feeling more like yourself again. Light activity, like a short, gentle walk, is generally fine once you're feeling a bit better, but listen to your body and don't push yourself. Overexertion while your body is still fighting an infection can actually prolong your recovery or, in rare cases, lead to complications, so it's better to err on the side of caution.
That makes sense. I'll hold off on my usual gym routine for now.
That's a wise decision. Give it about a week, and by then you should be back to your normal activities. All right, David, I think that covers everything. It was very nice meeting you today, and I hope you feel better very soon.
Thank you so much, Dr. Miller. I really appreciate your time and how carefully you explained everything.
You're very welcome. Please don't hesitate to call the clinic if you have any concerns or if your symptoms worsen. The front desk can always reach me or one of my colleagues if I happen to be unavailable.
I will. Thank you again.
Take care and get plenty of rest. Jessica leaves the room. The nurse comes back in briefly.
Mr. Anderson, here's a small folder with your after-visit summary, the work note, and the prescription. You can head to the front desk to check out and schedule any follow-up if needed. Thank you very much. David walks to the front desk.
All done with your visit, Mr. Anderson.
Yes, all done. Dr. Miller was fantastic.
I'm so glad to hear that. Would you like to schedule a follow-up appointment, or are you all set for now?
I think I'm all set for now. She said to only come back if things get worse or don't improve within a week.
Sounds good. Let me just process your visit today. Could I see your insurance card again, please?
Sure, here you go. The receptionist processes the paperwork.
All right, your copay today is $30. Would you like to pay by card or cash?
I'll pay by card, please.
Great, I'll just need you to insert your card here whenever you're ready. David inserts his card into the payment machine. Perfect, that's all set. Here's your receipt, and here's a card with our clinic's information in case you need to reach us or schedule a future appointment.
Thank you very much for everything today.
You're very welcome, Mr. Anderson. Take care and feel better soon.
Thank you, I will. Have a great day.
You too. Good afternoon, Riverside Family Clinic. How may I help you?
Hi, this is David Anderson. I was a patient of Dr. Miller's a few days ago, and I just wanted to give a quick update, if possible. I'm not having an emergency, just a couple of small questions.
Of course, let me see if Dr. Miller or her nurse is available. One moment, please. A short pause.
Hi, David. This is Karen, Dr. Miller's nurse. How are you feeling? Hi, Karen. I'm actually feeling quite a bit better. My fever broke yesterday, and my throat isn't nearly as sore anymore. The cough is still there, but it seems milder than before. That's wonderful to hear. That sounds like exactly the recovery pattern we'd expect. Did you have any specific questions? Yes, actually. Since my fever is gone now, is it okay for me to go back to work tomorrow? Let me just double check with Dr. Miller. But generally, since it's been more than 24 hours since your fever broke without needing medication, that should be perfectly fine. A brief pause as she checks. Dr. Miller confirms that's fine. Just continue resting when you can, keep drinking plenty of fluids, and if the cough lingers for another week or so, that's actually pretty normal. Coughs can sometimes take a bit longer to fully resolve even after the other symptoms are gone. That's good to know. Thank you. I was a little worried the cough was going to stick around forever. Laughing. It can definitely feel that way sometimes, but it should gradually continue to improve. If it's still quite bothersome after another week or two, or if it changes in character, becomes more productive with colored mucus, or you develop a new fever, give us a call, and we'll have you come back in. Understood. Thank you so much for checking in with me. Of course, that's what we're here for. I'm really glad you're feeling better, David. Me too. Please pass along my thanks to Dr. Miller as well. I certainly will. Take care, and don't hesitate to reach out if you need anything else. Will do. Thanks again. Have a great day. You too, David. Bye now. Bye.